Welcome to Alzheimer's Disease, Episode 4. In this section, Phillip Academy endeavors to continue its discussion with you by providing you with usable nuggets for becoming Alzheimer's resistant. In this section, we'll discuss your approach to becoming Alzheimer resistant. We'll discuss the individualized combination therapy protocol. We'll look at the various steps in the treatment of the disease process. We will discuss why treatment to protect you from Alzheimer's and or reverse the disease needs to be individualized. We will discuss how caring for your mouth can help to keep Alzheimer's disease away, and we will discuss the preference for the use of electrical brushes as opposed to the manual brushes. Making ourselves dementia or Alzheimer's resistance. In order to understand where we are at in terms of this particular approach, we need to be familiar with an individualized combination therapy protocol. As you would have been able to understand from the previous episodes, Alzheimer at best can be described as a multifactorial condition. There is no single approach to address its ravages. The individualized combination therapy approach is a more holistic attempt to resist the development of this condition. This is a 10-step plan. Individualized combination therapy in reversing Alzheimer's disease and making yourself Alzheimer resistant is based on a home-centric treatment protocol. In this protocol, patients are allowed to undergo multiple clinical investigations, inclusive of blood studies designed to determine the deficiency and imbalances which may exist. Thus far, 36 deficiencies have been identified. It seems that inflammation and hormonal imbalances all play a part in decreasing memory function. Some may have a larger deficit in vitamin and a smaller deficit in estrogen, but together, these deficits work together to bring about a decline in your memory. So here again, we talk about estrogen. Remember, we spoke about estrogen as being a culprit or a potential culprit in contributing to the development of Alzheimer's. Okay. Now, looking at the personalized, individualized combination therapy, we say that since Alzheimer's disease is multifactorial, treatment has to be individualized because what may be affecting me may not necessarily be affecting you. So what may have been a major contributor to my developing Alzheimer may not be identical in your case. So as such, a treatment plan has to be individualized, focused on you and your particular requirements and me and my particular requirements. So it's not a one band-aid type approach where one band-aid for all. We can't do that. So we say for this reason, before embarking on any treatment of Alzheimer's patients, we need to conduct basic investigations to find out what you are deficient in or what I am deficient in. The identification of deficiencies and their correction may fail to correct this disease. That is the basis for following all 10 steps of this protocol in a step-by-step manner. So if, for example, I am found to be short on one hormone, let's say thyroxine, my thyroid gland is dysfunctional. By correcting that doesn't necessarily mean that my Alzheimer's would go away. Okay? Since there's a need for us to conduct the basic investigations, find out what we are deficient in, but in addition to finding the deficiency, we need to follow a step-by-step plan in order to get the best results. The patient must follow each step in a chronological manner, in a step-by-step format. Completing steps out of order will not necessarily lead to the same result. Step 1. We need to reduce inflammation, stabilize our blood sugar levels, and Alzheimer's disease, as we said earlier, is often referred to as type 3 diabetes because of insulin resistance in the brain. Diets low in grains, simple carbohydrates, or sugars with low glycemic index. When we talk about glycemic index, we talk about the extent to which a particular food type causes your blood sugar levels to rise after a meal. Instead of processed foods, one should consume plenty of fresh foods, including vegetables and quality meats and fish. One should avoid eating less than 3 hours before bedtime. So those of us who like to have a late night snack, that's not good advice. You know, if you could have your last meal at least 3 hours before you retire, it will be better in terms of addressing any risk to developing Alzheimer's. It wouldn't stop you from developing it, but it would be a step in the right direction. In addition to the whole eating pattern, we'd say to you to allow a fasting period of 12 hours, at least 12 hours between your last meal and your breakfast. So if your last meal was about 7 o'clock in the evening, then your breakfast could be at about 7 o'clock in the morning. But if your last meal was about 10 o'clock in the evening and your breakfast is 7 o'clock in the night, that doesn't really qualify or fit you nicely into the protocol. So it would be advisable to look at your timing of your meals. We spoke about low glycemic indices earlier, food with low glycemic indices. There's some usefulness with regards to using foods of low glycemic indexes. The glycemic index is a rating system for foods containing carbohydrates. It shows how quickly each food affects your blood sugar level when that food is eaten on its own. Available scientific evidence shows that low glycemic index diets induce a number of favorable effects, such as rapid weight loss, decrease of fasting glucose, decrease in insulin levels. Okay. Foods of low glycemic index may reduce insulin-stimulated activity. Meal timing and glycemic index affect glucose tolerance and insulin resistance. So here are some of the advantages of the 12-hour gap between your last meal of the day and your first meal the next day, as well as your 3 hours cut off before you retire, of your last meal 3 hours before you retire. There's some of the advantages. Blood glucose concentration increases and stimulates insulin release after consuming high glycemic index foods. So as we have low glycemic index foods, we also have high glycemic index foods. The low glycemic index food, we talk about the benefits in terms of it reduces insulin-stimulated activity. It also reduces glucose tolerance and insulin resistance, whereas the high glycemic index foods increases the amount of insulin release after consumption of the meal. Hence the advice in the ICT protocol to avoid eating 3 hours before bedtime and allow at least 12 hours between your evening meal and breakfast. Insulin is an enigma. It has a short-term anti-inflammatory action, but also has a long-term pro-inflammatory action. So insulin can cause both anti-inflammation as well as can cause inflammation. The long-term exposure to insulin is pro-inflammatory, and that's what you don't want. You want to keep the inflammation in your system to a minimum, right? So it's advisable to avoid high glycemic foods. We also say that supplements such as DHA, that is deoxyhexanoic acid, or omega-3 fatty acids, or EPA, icosapentaenoic acid, also omega-3 fatty acids, and curcumin are useful supplements in the management or in the treatment of people who are at increased risk of developing Alzheimer, or who in fact have Alzheimer. Right? Both DHA and EPA reduces the risk of memory decline, possibly due to the effect of omega-3 on circulation. Curcumin is found in turmeric and has been shown to reduce amyloid plaques in the brain, thereby enabling better function. So those supplements can help in staving up or keeping Alzheimer's at bay. Then we talk about improving oral health as also a recommended feature in the ICT protocol. For that, we prefer the use of an electric toothbrush as opposed to manual brushing. With the electrical toothbrush, because of the many oscillations happening with the brush, it gives you a better, a more effective clean than oral manual cleaning. Hence, that's the reason why we tend to recommend an electrical toothbrush for brushing. That's for brushing our teeth or mouth. We look at the value of DHA. In keeping with Philip's academic motto of reducing medical speak and providing information in a simple, easily understandable format, we speak of DHA. DHA is associated with reduced risk of Alzheimer's disease. Note, I am not saying maybe, I'm saying is associated. It's a definite. Studies of plasma fatty acids have confirmed the dietary studies finding that plasma levels of omega-3 fatty acids, specifically DHA, is associated with a reduced risk of Alzheimer's disease. DHA is rich in synaptic functions, which is reduced in the brains of people with Alzheimer's disease. When we talk about synaptic factors, remember we spoke about acetylcholine earlier. This is the area in the synapses that the acetylcholine lives, which makes the connection between adjacent neurons. So DHA is rich in synaptic functions, which is reduced in the brains of people with Alzheimer's disease. So we understand the connection here. If you have Alzheimer, you have fewer synaptic connections. If you don't, you have a normal or a little more synaptic factors. But that can be increased or improved with DHA. DHA has been shown to reduce tau pathology. Remember we talk about tau angles in the Alzheimer patient? DHA tends to reduce that. It also reduces the amyloid plaques that we see in the brains of people who have passed on as a result of Alzheimer's disease. DHA supplementation can improve and also slow down the progress of Alzheimer's disease. So here we have already produced some useful nuggets in terms of helping to address Alzheimer's disease. We'll continue along that vein. We talk about hormonal decline. We, of course, have gone to talk about speaking about the value of estrogen in terms of trying to stave off Alzheimer's disease. We'll talk about a few others. It's a hormones decline with aging, leading to an imbalance. So as you get older, some of the hormones that are normal in your circulation will decline, and that comes and point a direct finger at estrogen. This can influence the functioning organs, including the brain hormonal levels. Those most commonly affected are estrogen, mentioned again, as well as thyroid hormones. Hormonal replacement therapy can be used to balance out the levels of each hormone and optimize their performance in the body, but may not necessarily help to restore memory. So here we have it. The hormones, those two most common hormones which are seen to be deficient in the Alzheimer patient are estrogen and thyroid hormone, thyroxine. Okay, so replacing those, however, although may help to palliate the disease, make it feel a little better for the patient, it may not reverse or stop the disease. We need to follow all the steps in the protocol. So one of the ways in which we find out which hormone is deficient, we test the hormonal levels. Full hormonal assessment should be carried out to determine if there are any imbalances that may be present. This includes a thyroid profile, steroids such as cortisol, estrogen, and testosterone. Interestingly, testosterone in the body is converted into estrogen. So if an individual is short on estrogen, and that's if a female is short on estrogen, giving them testosterone might help them to feel a lot more lively because of the testosterone conversion to estrogen. But in the presence of the uterus, it is ill-advised because testosterone replacement, because of its conversion into estrogen, has a negative impact on the endometrial lining, that's the lining of the uterus. So if you have the uterus in, testosterone replacement should only be given under guidance from a general practitioner or from a doctor. If hormonal imbalance is detected on investigation, then this should be treated. Treatment of stress reduction would involve the use of some stress busters. Things like daily medication, yoga, massages, as I mentioned earlier, vitamin D replacements, and case in point, if one is deficient in vitamin D3, they're twice as likely to develop Alzheimer's disease. Ashwagandha prevents the development of beta amyloid plaques from developing in the brain, thereby reducing the symptoms of Alzheimer's. Ashwagandha is a product which we find mainly in some Indian medicines. They tend to, as it says here, reduce the incidence of the amyloid plaques in the brain, and as such, helps to protect against Alzheimer's. Then we talk about this third step in the whole ICT protocol. We talk about optimizing antioxidants. When fats are oxidized in the brain, there's a strong relationship with the development of Alzheimer's disease. So the way you prevent that from happening is by increasing the amount of antioxidants in your system. The optimization of antioxidants will reduce the possible prevention. The optimization of antioxidants will reduce and possibly prevent the formation of amyloid plaques and thus reduce the risk of Alzheimer's disease. Hence, to be protective against Alzheimer's disease, antioxidants such as vitamin C and beta carotene can be added to your diet to supplement your diet. One suggested treatment to increase your vitamin C load would be a cup of blueberries each day. This is a useful addition to one's diet. It has a tangy taste, but it is very healthy. Spinach, kale, oranges, and other fruits high in beta carotene or vitamin C should be able to reduce the rate of memory decline. So just by introducing vitamin C rich foods may help to reduce or slow down your memory decline from Alzheimer's disease. Supplemental treatment involves the use of vitamins like vitamin E, selenium, vitamin C, N-acetylcysteine, alpha-lipoic acid. All of those help to reduce your development of Alzheimer's disease. That's just part of the treatment protocol. Supplements could be added to your regular regime to try to help to further release or reduce the risk of Alzheimer's disease. Individuals with low levels of vitamin E are prone to developing Alzheimer's. Selenium helps to protect the nerve function in the brain, thereby preventing memory loss. N-acetylcysteine, or NAC, protects the nerve cells by acting as an anti-inflammatory agent, and alpha-lipoic acid is a powerful antioxidant that can effectively slow down the progress of Alzheimer's disease. We mentioned earlier about the oxidation of fats in the brain and how best we can try to prevent that from happening, since that whole process encourages the development of Alzheimer's disease. 60% of our brain is made up of fat. The addition of powerful oxidants such as chlorine in our water we drink increases the risk of oxidation of fats in our brain and thus increases the risk of developing Alzheimer's disease. So the innocent water we drink from our taps, because of the chlorine added to the water, it adds to our risk of developing Alzheimer's disease. But not only that, one must understand why chlorine is added to the water. Chlorine is added to water in order to try to keep the water pure as it's moved from the area where it is sourced to our homes. That chlorine, though, is one of the most powerful antioxidants in the oxidation fat in the brain, as indicated before, is strongly associated with the development of Alzheimer's disease. 60% of our brains is made up of fats. The addition of powerful oxidants such as chlorine in our water supply, for example, increases the risk of oxidation of fats in the brain. Chlorine occupies one of the top positions in the electrochemical series, which indicates how powerful it is as an oxidizing agent. The reason for adding chlorine to the water is to keep it pure when it is moved from the area it is sourced to our homes, but that has an ill effect on our health. It is, for example, one of the culprits involved in the development of Alzheimer's disease. It's also a potentially strong, ridiculously strong element in the causation of cardiovascular disease. And you'll learn more about it as we go through the podcast series on the cardiovascular disease. Yeah, but chlorine in water has its use, but also dangerous to our health. We speak again about regular brushing of our teeth. Bacteria associated with gum disease, such as P. gingivalis, have been found in the brains of Alzheimer's disease. All right? So if you look at the brain of patients who have died from Alzheimer's disease, interestingly, a bacteria which is found in the mouth, P. gingivalis, is also found in the brains of patients who have succumbed to Alzheimer's disease. This is not mere coincidence. So if we can reduce our load of pre-gingivitis in our mouth by regular brushing, we are making a right step or a step in the right direction to try to keep us free of Alzheimer's disease. In the brain, the bacterium P. gingivalis triggers an immune response which promotes inflammation, which can be deadly to our brain cells. It can also trigger amyloid formation, which is associated with Alzheimer's disease. So don't take P. gingivalis lightly. It has a potent, dangerous effect on our brains, both in terms of causing inflammation as well as developing amyloid in our brains, which is associated with further development of Alzheimer's disease. It is therefore considered good practice to brush your teeth at least twice a day, not only for hygienic purposes, but it may help you to remember the goodies of life, so preventing or reducing your risk of Alzheimer's disease. Electrical toothbrushes decrease plaque and gingivalis by 11 to 21% after 3 months of use. I'll say that again. Electrical toothbrushes decreases plaque and gingivitis by 11 to 21% after 3 months of use. Hence, it's time to step up on electrical toothbrushes to brush your teeth regularly, because after 3 months of use, you have a significant improvement in your overall long-term health as far as your mental health is concerned. Then we look at step 4, optimizing our gut flora. Healthy gut flora is essential for brain function. The treatment diets based on whole, healthy foods, eliminating grains, carbohydrates, and sugars, help to prevent upset of gut flora and so optimize gut health. Treatment supplements such as probiotics can be used to supplement gut health. Probiotics break down to gamma-butyric acid or GABA, and GABA is a neurotransmitter, and its deficiency leads to a decline in memory and dementia. Step 5, we talk about plenty of healthy fats. Stay away from harmful fats. Trans fats, for example, ill-advised. Healthy fats are needed to maintain healthy brain function. Unhealthy fats include those found in dairy and eggs. Also those fast food fats, well, I wouldn't call names here, but those fats which are used for frying chickens, making burgers and so on, because of their repeated use, are broken down into trans fats, which are not healthy. They taste nice, but they are not healthy to our bodies, so be careful. Healthy fats are those that are polyunsaturated and monounsaturated, including fats obtained from avocado, oils, seeds, and nuts. Healthy fats play an integral role in the production of acetylcholine, a major neurotransmitter essential for learning, concentration, and memory. The treatment here is more DHA and more EPA. Coconut oils can also be useful. Steps 6, 7, and 8 in our protocol talk about enhancing cognitive performance and NGF levels. Recommended supplements include lion's mane, we made that already, Hericium ericaceous, mushroom extract, Bascopa moneri, and citicoline. Lion mane is a mushroom which has been shown to have positive effects on how the brain works. We already looked at its effect on the neurotransmitter acetylcholine. Similarly, Bascopa is a herb used in Indian medicine to treat problems with memory. In human, it leads to improvement in maintaining attention and verbal recall. Citicoline increases the production of phosphatidylcholine. And step 7 boosts mitochondrial function with pyroquilline, PQQ, and coenzyme Q10, tends to increase the formation of amyloid. Pyroquinoline, PQQ, and coenzyme Q10 tends to reduce the formation of amyloid. Step 8, mental and physical exercises. As we have said before, that increases the blood flow to the brain, and even just mental exercises like crossword puzzles and so on helps to keep you mentally astute. So those exercises will help to keep the development of Alzheimer's at bay. Then we talk about steps 9 and 10. Remember, we said that the ICT protocol is a 10-step protocol. So we have gone through all 8 steps so far. We're going to talk about steps 9 and 10. We talk about ensure we have adequate amount of oxygen during sleep. This is essential so that your brain is adequately oxygenated during rest. During restful sleep, hear this, the brain is least active and undergoes mild shrinkage. That shrinkage is not the same sort of shrinkage you see in Alzheimer's. This type of shrinkage that occurs during your sleep is a physiological shrinkage to allow the brain to cleanse itself. So this allows for cerebrospinal fluid, that's the fluid that washes the brain, to remove various toxins that negatively impact the way our brain functions. So by having some good rest, our brain physiologically shrinks, creates a little more space through which the fluids can flow to clean the brain. Hence, we go back to the earlier advice that 7 to 8 hours of sleep a night is very useful. In step 10, we talk about removal of heavy metals from our body. How do we do that, you say? Detoxification is one approach we can use. Metals we need to remove from our body would be metals like lead, arsenic, which is common in rat poisoning, cadmium, mercury, aluminum, uranium, strontium, and thallium. The treatment is simple, chelation therapy. Now, prior to recently, chelation therapy could only be conducted in hospital settings. Now, however, there are oral preparations which you can use to help to rid your body of heavy metals. Some tablets you could get over from Amazon. You could buy them and take them as prescribed to help to reduce your level of heavy metals in your body. This brings us to the end of Alzheimer's disease, episode 4. So we have looked at the individualized, customized therapy for trying to prevent or to reduce the aggressiveness with which Alzheimer damages our person. So we talk about the individualized combination therapy protocol. For that purpose, a 10-step protocol, which if followed in a systematic manner, will help to at least prevent or delay the progression of Alzheimer in an individual who suffers from this condition. So in this section, we discussed an easy-to-follow individualized guide to keep you and your loved ones free of Alzheimer's disease. We have discussed how chlorinated water can increase your chances of developing Alzheimer's disease. We have discussed the value of brushing your teeth with an electric toothbrush in the fight against Alzheimer's disease. We have discussed the use of supplements such as DHA and fish oils in resisting and even improving the symptoms associated with Alzheimer's disease. The summary of Alzheimer's disease. In this section, we discussed Alzheimer and its impact on the lives of the patient, their relatives, and caretakers. We discussed the various types of memory, distinguishing one type from another. We looked at memory enhancers and how they work. We discussed the distinction between Alzheimer's disease and dementia. We discussed a variety of known causes of Alzheimer's disease. And we produced a guide on how you're able to keep yourself free from Alzheimer's disease. With your brief recap, so far in Alzheimer's disease, we have covered 4 episodes. In episode 1, we looked at how Alzheimer's disease becomes noticed. In episode 2, we reflect on Alzheimer's disease as the most devastating disease of all time. In episode 3, we looked at the known causes of Alzheimer's disease. And in episode 4, we introduced the individualized combination therapy as a treatment plan to stabilize and subsequently reverse Alzheimer's disease. If you wish to know a bit more about this condition is memorialized in bite-sized portion in my book, Reclaiming Your Health, subtitled Alzheimer's. The increased details of Alzheimer's disease will be found in the disease with the subtitle Alzheimer's disease. An image of the book cover is seen at the start of each podcast. This book provides you with both a useful guide and an important reference material, if you will, that will ensure that you always have this useful information at your fingertips. Reclaim Your Health is a library of 12 books which seeks to address the 9 common chronic health challenges of our time. There are books on cancer, Alzheimer's disease, cardiovascular disease, diabetes, arthritis, obesity, chronic lung disease, chronic kidney disease, bowel disease, women's health, men's health, and stem cells. I thank you.